And here the OsteoHealth is the company in the United States where they were able to import the horse bone, the OCSH, which is from Nyback, the Korean company, and they call it Equimatrix. And for this study, what we were able to do is that we are able to do a preclinical study utilizing this bone graft as a carrier for the growth factor, PDGF. And in this canine study, the result was that the OCSH, the horse bone, the Equimatrix, was equivalent or actually better carrier for the growth factor when we are doing periodontal regeneration. And we did the follow-up studies where we have done working with the European colleagues to do a sinus study using this equine bone graft. And not only we did the sinus augmentation, but we did the histology to show that at 6 months post-augmentation, you still have some remaining graft particle, but then you have an abundant amount of the new bone formation in this area. And we have published another study in 2014 working with the colleagues in the United States to demonstrate that we do have still remaining graft particles in the socket area after 6 months, but then we have an abundant amount of the new bone formation using this graft particle. And back in 2014, we also have published the case reports or case series where we were able to treat very large extraction site defect using this equine bone graft in addition to the growth factor. And here in this case, after the extraction of the diseased teeth, there were vertical and horizontal ridge defect where we were able to use the tenting screw, use the Korean made the equine bone graft, the PDGF, and the collagen matrix. And we are able to achieve both vertical and horizontal ridge augmentation, placed into implant, and the case got restored. And when we did a biopsy, that we are able to see good new bone formation surrounding the graft particles. And as we are doing more of these studies, that I had more opportunity to work with Dentium's synthetic bone graft, the Osteon 2, and Osteon 2 collagen. And this was a very exciting time for us because as the company came up with the new products, that we are able to utilize these new products in an animal model, and then trying to replicate the data that we have achieved in the clinical setting. And then this is the membrane that was manufactured from Dentium. Now they sell it in the United States from at Charmin. The brand name is Membrane Plus. And this is also the membrane, and that's available for the clinician to be used in the United States. Let's look at some of the studies, the preclinical studies that we have done utilizing these bone grafts and the membrane. And this is the latest the study that was published in 2016. We are working with the colleagues from Genos that we are able to utilize the new bone graft, the Osteon 3, as a potential carrier for the PDGF and the BMP2, which are the growth factors that are available. So we have done a tremendous number of the studies before actually applying these concepts or the material to our patient care. And this is a study that we have done where preclinical study where we have extract the premolar and a molar from the canine. And we decide to make a very large defect because there are so many different type of bone grafts